Medicaid covers millions of Americans, and the TAF data opens powerful opportunities for research. But with complex files, state-level variation, and shifting data quality over time, it can be tricky to make sure your study is credible and reproducible. That's where the TAF Checklist comes in. It's a practical tool that helps you clearly report the key elements of your TAF-based study, so your work is transparent. First, be clear about which TAF files and years you used. For example, data for this study came from the TAF Other Services and Annual Provider files for 2017, Release 2, 2018, Release 2, and 2019, Release 1. If you used a subset extract, say so. We derived our study cohort from a 2016 Release 1 20% sample of Medicaid beneficiaries in Texas, California, and New York. Next, explain how you defined your analytic sample. For eligibility criteria, you might say, we limited our analysis to individuals eligible under the ACA Medicaid expansion as identified by eligibility group codes 72 through 75. For enrollment span, we included individuals with at least 6 months of continuous enrollment. For scope of benefits, our sample included only enrollees with full scope or comprehensive benefits. Be clear about whether you included enrollees in managed care. We included enrollees participating in comprehensive managed care plans for more than 6 months using both fee-for-service and managed care claims. And for dual eligibility, we excluded individuals duly enrolled in Medicare and Medicaid at least 6 months in the year. Be sure to document which states or territories were included or excluded based on data quality. For example, we excluded states flagged as high concern or unusable in the DQ Atlas for total Medicaid enrollment. States with more than 10% missing national provider identifier data were excluded. Or, we included only states where live birth volumes differed less than 20% from CDC natality data. Finally, be sure to address 2 special considerations. For spending data, we measured total spending per enrollee, including fee-for-service claims, capitation payments, and supplemental payments. For studies using MAX data, our study combined MAX data for 2014 and 2015 with TAF data for 2016 through 2018, and we checked trends to ensure the MAX to TAF transition didn't introduce data anomalies. Using the TAF checklist strengthens your research. It clarifies your methodology and enhances reproducibility, safeguarding the quality of research used to inform Medicaid policy. Make the TAF checklist part of your workflow. Download it today.